Welcome, everyone. Thank you for joining us for today's webinar. My name is Edgar Manuel Canta, and I'm your MC. A very welcome to all. It's a wonderful day, and I feel privileged to extend my warm welcome to all presented here. Welcome, everyone, to the Drug Resistance Awareness webinar. I'd like to introduce our first speaker. She is a 19-year-old and a second-year pharmacy student in Lyceum Northwestern University. From Bayawas, Aguilar, Pangasinan, is Desiree Adona.
Thank you, Edgar, for the introduction. It's great to be speaking with all of you today. As predicted by the man who discovered the first antibiotic, Alexander Fleming, drug resistance is upon us. What is drug resistance? Drug resistance is defined as a significant decrease in response to a drug in a previously susceptible microbe population. So, ano nga bang kabilang dito sa mga microbe na to? This includes your bacteria, viruses, parasites, and fungi that are able to grow in the presence of a chemical or drug that would normally kill or limit its growth. Meaning, yung effectiveness ng drug is nawala or nabawasan. Kapag nabawasan yung or walang epekto yung drug sa tao, hindi niya magagamot yung sakit. Next. Here is a comparison of a non-resistant bacteria and a drug-resistant bacteria. In a non-resistant bacteria, you can see in the illustration that after entering the body, the bacteria will multiply. After taking a drug, the bacteria will die and the person will be healthy again. On the other hand, in the drug-resistant bacteria, after entering the body, the bacteria will also multiply and will cause an infection. But even after taking a drug, the bacteria will survive and continue to spread. The person will remain sick. Next slide. Take a look at this illustration. For more specific example, we have here Helicobacter pylori bacteria, and for the drug, we have antibiotic. For a normal Helicobacter pylori, it would be killed by an antibiotic. While a mutant Helicobacter pylori will survive and continue to reproduce and produce offspring that resist antibiotics used to treat it. Next slide. Let's now proceed to the mechanism of drug resistance, or how drug resistance works. Here are 5 ways. First, production of enzymes that destroy, modify the active drug. We have what we call resistance gene. Itong resistance gene na to, it is what gives the microbe an ability to resist drug. This resistance gene encode enzymes that would modify a drug, thereby inactivating it or destroying it through hydrolysis. Next. Second mechanism of drug resistance is synthesis of an altered target site against which the drug has no effect. Ang mga drug kasi is may specific target site sila. And kapag may nabago sa structure ng mga target site na yon, mawawala ng epekto yung drug. Katulad nga ng sinabi natin kanina na kapag walang epekto yung drug, syempre, hindi mapapagaling yung sakit. Next. Reducing drug accumulation. Reducing drug accumulation para mapigilan yung drug na ma-reach niya yung cell. There are two ways in reducing drug accumulation. The first one is decreasing the permeability of cell membrane. This includes the change in the outer lipid membrane composition, porine channel selectivity, and porine channel concentration. And yung second, actively exporting drugs through multi-drug resistant pump or efflux pump. Itong mga efflux pump na to, ito yung mga nagtatransport ng drug palabas ng cell. Next. Altering the metabolic pathway so that the reaction inhibited by the drug can be bypassed. It is also called as the enzymatic bypass. From the word bypass, parang hahanap siya ng ibang ruta or pathway kung saan mas mapagbibilis yung reaction. Next. Number 5, developing an altered enzyme that is less inhibited by the drug but still perform its metabolic function. Dito, nagkakaroon ng overproduction ng target enzyme. Yung mga target enzyme na kasi na yun, doon nagbabind yung drug. Kapag lahat na ng drug is meron ng pagbabindan na target enzyme, tapos may mga sobra, ibig sabihin yung mga sobra na yun, mapapatuloy na nilang gawin yung reaction nila without being prevented by the drug. Next. Back. Last is target mimicry. So, recent lang to na-discover in which, from the word mimicry nga, gagayahin yung target site. Kaya parang malilito yung drug, imbis na ma-reach niya yung talagang target site niya, kung saan siya magbabind, is iba yung target site na napupuntahan niya. Kaya mawawalan ng epekto yung drug. Next, let's proceed now to the types of drug resistance. First one. Primary, natural, non-genetic origin of resistance. So, dito, sinabi niya nga, natural na sa kanila na may, yung mga microbes, natural na sa kanila na may ability sila na i-resist yung drug. So, yan. Sa Salmonella, the first example, dito naman is yung mga microbes, ang paraan nila is, ang ini-infect nila na lugar is yung hindi kayang i-access ng drug. Then, the second example is Mycobacterium tuberculosis. Dito naman, yung mga microbe is nag-stay silang dormant or sa resting state nila hanggang sa mawala yung epekto ng drug. And yung sa last, yung sa target nila, kapag parang gagawa sila ng ibang target and yung resistance din ng itong pang example is nade-develop through time. Parang sa susunod na generations, yung mga unang generations na wala silang resistance, as the time goes by, yung mga next generations nila, magkakaroon na ng resistance dun sa drug. Next. So, second type ng drug resistance is acquired genetic origin of drug resistance. So, sa word na yan, acquired or genetic, pag acquired is, yun nga, nakukuha nila or mismong nade-develop nila through mutation. So, there are two classifications under this acquired or genetic origin of drug resistance. First is, next slide. Chromosome-mediated resistance, yung katulad nga ng sinabi ko kanina, through mutation ng genetic material. Yan. Next. Yan yung illustration ng mutation. Yung una is non-resistant bacteria pa lang siya. Then, nagkaroon ng mutation in DNA. Then, that makes the bacteria drug resistant. Then, the bacteria, kaya pag drug resistant na yung bacteria, patuloy na siyang magsusurvive, then magmumultiply, and katulad nung kanina na example, magpuproduce sila ng offspring na drug resistant na din sa drug na yon. Next. Next. So, ito yung second classification under acquired or genetic origin of resistance, transferable drug resistance. From the word itself, transferable, nata-transfer yung resistance gene. Diba yung kanina nabanggit ko na ang resistance gene is yung nagbibigay ng ability sa microbe na ma-resist yung drug. So, yung genetic material na yon or resistance gene is napapasa. There are two ways kung paano maipasa yung resistance gene na yon. The first one is plasmid-mediated resistance through a plasmid. Yan yung illustration. The bacterium with an R plasmid is multiple antibiotic resistance and can produce a sex phylus, serve as a genetic donor. Then second, the sex phylus adheres to an F or female recipient. One strand of the R plasmid breaks. Next. Under, again, transferable drug resistance is transposon. Itong transposon na to is gene din siya na nagko-contain ng gene din siya na, pero yung pag-transfer nito is sa sarili lang mismo ng bacteria na yon. Like, sa DNA niya, parang malilipat lang ng position yung DNA segment na yun, parang malilipat-lipat lang ng position yung gene sa DNA ng isang bacteria. Yung itong transposon na to, they are also called as jumping genes. Next. Mode of transfer of resistance. We have two. Horizontal gene transfer, also called as lateral gene transfer. Dito, yung pag-transfer ng genetic material or yung resistance gene is from an organism to another organism na hindi niya offspring. There are three types of horizontal gene transfer. transduction, conjugation, transformation. Sa transduction, through natatransfer yung gene through a bacteriophage. Ang bacteriophage ay virus na nag-i-infect ng bacteria. Yun. Next is conjugation. This is the most common mode of transfer ng resistance gene sa mga bacteria. Yan. Meron tayong donor and may recipient. Next naman, lastly, is yung transformation. Sa transformation, yung genetic material ng patay na ng bacteria is maipapasa sa active na bacteria. Yan, makikita sa illustration. Next. Second and last na mode of transfer ng resistance is transposition. Ito naman is kabaliktaran siya ng horizontal. Transposition is also called as the vertical gene transfer. Dito naman is naipapasa siya sa offspring ng isang microbe. Unlike dun sa horizontal gene transfer na sa hindi niya offspring. Next. So, we must remember na hindi lang applicable sa antibiotic yung drug resistance kasi alam natin na most common na type ng drug resistance is antibiotic. Ayun yung mas pinaka-familiar sa atin and yun yung most abused drug. Pero, kailangan natin itatak sa isipan natin na lahat ng drugs is pwedeng ma-abuse and can also lead to drug resistance. Just like our OTC. At alam ko na most of us are guilty in using over-the-counter drugs or yung mga drugs na nabibili natin even without prescriptions like paracetamol. Kahit sa onting sakit lang na maramdaman natin. So, dapat we have to practice proper use of drugs and we must consult our pharmacist kasi sila yung expert sa medicines. And alam naman natin na palala ng palala yung mga sakit like this coronavirus. Nag-e-evolve din sila. And sana hindi dumating yung time na lahat ng drugs is mawala na ng epekto sa tao na hindi niya na mapagaling yung mga sakit ng tao. So, yun lang. Thank you so much for listening. Any questions? Feel free to ask questions.
Question po ako. Possible po ba
Yes,
yung
Lance.
resistance?
Yes, possible ang multiple drug resistance. Just for example nito is sa bacteria. Sa bacteria, pwede magkaroon ng multiple drug resistance. And yung mga bacteria na may nagtataglay ng ability na marami silang drug resistance, hindi lang sa isang gamot, tinatawag silang superbugs. Any other questions?
Thank you, Ms. Desiree Adona, for giving your insights about introduction of drug resistance. Now let me introduce our second speaker. She is also a second-year pharmacy student in Lyceum Northwestern University and a 20-year-old lady from San Fabian, Pangasinan, Ms. Charmaine Barreiro.
Thank you, Mr. Edgar. Hello, everyone. My topic is all about antibiotic resistance. Okay po. So first, I will discuss what is antibiotic. So what is antibiotic? Antibiotics are powerful medicine that fight bacterial infection. Um, Antibiotic used to treat bacterial or prevent bacterial infection. It's either antibiotic will kill or prevent the growth of bacterial. Literal translation, anti means again, and biotic means living things. Next po. So, discovery. Alexander Fleming in 1928, he discovered accidentally a natural growing substance that could attack certain bacteria. Upon returning from a holiday, he noticed that a fungus had contaminated a culture plate of Staphylococcus bacteria he had accidentally left uncovered. That mold prevented bacterial growth. Okay po, next po. Yan. Staphylococcus. In a genus of gram-positive bacteria in the family Staphylococcai from order Bacillales or Bacillus. Under the microscope, they appeared spherical cocci that form in grape-like cluster. Kung makikita po natin sa illustration, para po silang mga grapes lang. Kaya yun po, sabi niya, form in a grape-like cluster. Next po. How antibiotic work? Antibiotic can be either broad spectrum or narrow spectrum. When we say broad spectrum, kill wide range of bacteria, while narrow spectrum kill specific type or group of bacteria. And next, antibiotic work in one of two ways: bactericidal or bacteriostatic. When we say bactericidal, kills the bacteria. When bacteriostatic, prevent the bacteria from divided. So, yan. Antibiotic resistance. So, what is antibiotic resistance? Next po. Yan. Antibiotic resistance, the ability of microorganism to avoid the harmful effect of antibiotic by destroying it, transporting it out of the cell, or undergoing changes that block its effect. So, yun po. Ang antibiotic, ang antibiotic resistance, imbis na gumaling yung isang tao, ay binablock niya yung paggaling yung sakit ng tao, binablock ng antibiotic resistance para imbis na gumaling, mas lumalala. Sa next slide, ipapakita natin kung ano ba yung yan. How antibiotic resistance happen. First, kung makikita po natin dun sa first circle, na meron po siyang normal bacteria, which is yung color brown, at yung color blue naman po, yun po yung resistant bacteria. Lots of germs are drug resistance. Sa first circle, makikita natin na mas marami si normal bacteria kaysa kay resistant bacteria. While sa second circle, si brown bacteria naging color pink na, which is dead bacteria na sila. At si resistant bacteria, kung ano siya, ganun pa rin siya. Kumbaga, hindi siya nadamay or hindi siya namatay dun sa nung mga normal bacteria. Yeah. Antibiotic kill the bacteria, causing the illness, as well as the good bacteria protecting the body from infection. And yung third circle, the drug-resistant bacteria is now able to grow and take over. Kung mapapansin po natin, yung resistant bacteria yung mga hinawaan niya yung ibang normal bacteria para maging resistant bacteria. Kumbaga, for example, sa ating mga tao, yung COVID, di ba? Kung mapapansin natin, yung COVID, sa isang tao, once na infected siya at nakipagsalamuha siya sa ibang tao na hindi naman infected, maya-maya magiging infected na rin sila. Parang ganun po si resistant bacteria. So yun, ang last, and some bacteria give their drug resistance to other bacteria. Parang ganun po. Next po. Yun. Did you know less than 1% of different types of bacteria make people sick? However, bacterial infection are most common cause of sepsis. Next po. Yan. Cause of antibiotic resistance. Overuse and misuse. Ito. Madalas po na overuse at nami-misuse po natin ang antibiotic resistance. Dahil dito, mas imbis na once na nag-take tayo ng gamot, imbis na gumaling tayo, mas hindi tayo gumagaling kasi nga nagiging ano na yung mga bacteria, nagiging immune na sila doon sa antibiotic na tinitake natin. So, kung makikita po natin doon sa poster, sabi dyan, I don't cure cold. I'm no helping with a cough. Don't need me for sinus infection, not for a sore throat. Yan po. Pero kasi minsan, kahit hindi naman talaga siya para doon, gumagamit pa rin tayo. Once kasi na nakaramdam tayo ng sakit, kadalasan antibiotic na agad yung dapat nating, iniisip natin mag-antibiotic ka kasi yun yung mas magandang inumin, parang gano'n. Next po. Yan. How antibiotic resistance can be prevented? Po. Antibiotic should be the last line of defense, not the first. Parang yun nga po, dapat pag may sakit po tayo, huwag tayo agad magti-take ng antibiotic. Kailangan mag-take muna tayo ng other medicine na hindi siya antibiotic. Nang sa ganun, hindi maging immune yung mga bacteria dun sa antibiotic para in case na hindi gumana yung gamot na ininom natin, pwede tayong mag-take. Kung kinakailangan, pwede tayong magkapag-take ng antibiotic para mas gumana siya, parang mas magkaroon siya ng effect sa atin. And next is, only take antibiotics prescribed by a doctors. Yun nga po, once na hindi talaga gumana sa atin yung tinitake nating gamot, mas mabuting magpa-consult muna tayo sa doctor natin at kung niresetahan tayo ng antibiotic, saka doon lang po tayo uminom ng antibiotic. And third is, if prescribed antibiotic, finish the course. Ito po, napaka-importante ito. Kasi karamihan sa atin, once na prescribe tayo ng doctors natin ng antibiotic na i-take natin siya for 7 days. Pero karamihan, once naggumaling na sila or wala na silang nararamdaman na sakit sa kanila, hindi na sila nagtitake ng antibiotic. So, mali po yun. Bakit? Kasi, mas lalong hindi tayo gagaling. Kumbaga, oo, gumaling tayo, wala na tayong nararamdaman noon. Kaya nga natin tinigil yung pagtitake. Pero, hindi natin alam, siguro sa mga susunod na araw, babalik na naman yung sakit natin kasi mas nabubuhay yung mga bacteria. Imbis na mawala sila, mas lumakas sila, parang ganun. Yun. Do not use other people or leftover antibiotics. Ito, syempre, hindi naman porket gumana yung gamot dun sa isang tao, gagana na rin sa atin. For example, yung kapatid ko may sakit, pinainom siya ng antibiotic kasi yun nga yung prescribe sa kanya ng doktor. At gumaling siya doon sa antibiotic na yon. Tapos, next other week, ako naman yung nagkasakit. Pero hindi ako nagpa-doktor. Ang ginawa ko, ininom ko lang yung gamot na natira ng kapatid ko. So, mali po yun. Bakit? Kasi hindi naman porket gumana sa kanya yung gamot, gagana na rin sa atin. Gagana na rin sa akin. Kasi, yun nga, kaya dapat hindi po tayo basta-basta umiinom ng mga tira or ginamit ng ibang tao. Yun po. Next po. Yun. Last pala, get well soon without antibiotics. Yun nga. Hanggat maaari, huwag tayong magtitake ng antibiotics kung hindi naman kinakailangan. At dapat, yun nga, mabawasan natin yung pagtitake ng antibiotics para maiwasan din natin yung antibiotic resistance. Yun lang po. Thank you. And any question po?
May question po ako.
Yes
Anong
po.
mangyari pag ma-overuse and misuse ng antibiotic?
Yun po. Yun nga po. Tulad po ng sabi ko kanina na kailangan dapat wag natin siyang ma-misuse or ma-overuse ang antibiotic. Kasi nga once na na-misuse or na-overuse natin ang antibiotic, mas mahihirapan tayong gumaling or mas mahihirapang mamatay yung bacteria na nasa loob ng katawan natin. Why? Kasi nga, 'di ba, yung mga bacteria once na misuse or na overuse natin yung antibiotic, mas nagiging immune sila. Mas naging immune sila imbis na mamatay nga sila, mas dadami pa sila. Tapos yun nga, sa pag once na nasobrahan natin, magiging kabaliktaran yung mangyayari. Kaya karamihan, imbis na gumagaling sila sa antibiotic, mas nagkakasakit sila kasi nga nasosobrahan or mali yung paggamit nila. Kaya hanggat maaari, huwag tayong iinom ng antibiotic kung hindi naman talaga kailangan. Yun lang po.
Thank you.
Any questions po? Meron pa po ba? Wala na po. So, that's all for today. Thank you.
Thank you, Ms. Shermaine Barreiro, for giving your insights about antibiotic resistance. Now for our last speaker. He is also a 20-year-old man and also a second-year student in Lyceum Northwestern University from Cabilawan, Lawak, Pangasinan, Mr. Mark Levy Rito.
So thank you, Ed. So our topic today is all about the reasons and factors and development of drug resistance and prevention and control. So next slide. So before ko discuss tong tong antibiotic or factors and prevention is which is ito yung first is the use of antibiotic has saved millions of lives, but its pervasive use to treat any infection, whether serious, minor, or even viral, has led to increase of antibiotic resistance. So, I will emphasize ko lang tong phrase na to, the use of antibiotic has saved millions of lives. So, lahat, kumbaga, ako, na kumbaga naligtas na ako na ng paggamit ng antibiotics. Last year pala, I will share my experience na naoperahan yung paa ko. Naoperahan yung paa ko dahil nagkaroon ng infection. And then, ayun, after ng operation, or before ng operation, nagtitake na ako ng antibiotic. And after ng operation, then initsakan na naman ako ng another antibiotics. And then, after nun, gumaling ako. So, yun lang, i-share ko lang yung experience ko sa pag-take ng antibiotics, which is yun. So next is antibiotics strictly target bacteria, but it's sometimes difficult and differentiate between viral and bacterial infection without costly tests. So dito, kanina sinabi doon that sa previous speaker natin that antibiotics tina-target niya doon yung bacteria. So sometimes tayo mga Filipino minsan hindi natin alam yung viral and bacterial. So ano ba yung mga viral infection na nakuha natin is which is example na doon is yung flu. So yung flu which is may tatlo tayo o apat na nararamdaman. So may lagnat tayo, may ubo tayo, or sipon, or masakit yung katawan natin, which is kahit yun yung apat yung nararamdaman natin is umiinom pa rin tayo ng antibiotic, which can lead na naman yun ng antibiotic resistant. And then dapat magpa-test muna tayo ng kumbaga may nararamdaman na tayo masakit sa ating katawan, and then dapat kailangan natin magpa-test sa mga doctor or physician tayo. Next is antibiotic usage is also not exclusive to humans. Every day, antibiotics are used to treat livestock and fish to prevent infection similar to overuse in humans. Uncontrolled use of antibiotic creates a reservoir of bacteria that could become resistant, thus rendering the antibiotic useless. So, dito, ang antibiotic hindi lang para sa humans, also humans. Para kumbaga, ginagamit din to sa mga hayops, especially sa mga poultry farm. Ginagamit to sa mga baboy, manok, para hindi na din sila, kumbaga, hindi sila maghawaan. Sometimes, ganito, for example, ganito, meron kumbaga, yung nagbabantay doon sa poultry farm, kumbaga, injectan yung isang hayop na or yung manok ng antibiotic. So yun, gumaling siya. After nun, parang hindi na satisfy yung kumbaga nagbabantay, injectan niya ulit yung tawag dito yung manok. So it can lead yun ng antibiotic resistant din. No? Kumbaga, pag injectan mo ulit, kumbaga bumalik yung infection, injectan mo ulit ng antibiotic. Kumbaga wala nang immune na yung bacteria doon sa antibiotic nun. And then tapos kakatayin yung manok. And then after nun, pag kinain nung consumer, ayun, mahahawaan din siya or pwede din siyang mahawaan ng antibiotic resistant na yun. So magiging useless yung antibiotic. So next. So one of the less contributing factors antibiotic resistant is lack of new antibiotics being developed. Yes. Sabi nga kanina doon sa previous na mga speakers that kumbaga nag-evolve din yung bacteria or nag-produce ng mga offspring yung mga bacteria. Kaya nagiging useless din yung mga antibiotic na nakikreate ngayon. Dapat mag-create din ng fund yung mga pharmaceutical industry para maka-create ng bagong new antibiotics para malabanan yung infection na yan. So another issue is the antibiotics inability to monitor patient intake. So next na lang. Next slide. So ito naman na yung mga factors of antibiotic resistance. So number 1 is yung overprescription of antibiotics. So ito, yung overprescription of antibiotics, some patient na binigyan ng prescription, and then after nun, bumaling sila. And then after nun, ginamit nila ulit yung prescription na yon. Kaya baka, ang tawag dito, yung gamot na ginamit niya nung last na nagkaroon siya ng infection, baka yung antibiotic na yun is hindi para doon sa nararamdaman niya. So it can lead na naman yun ng antibiotic resistant, or baka wala nang epekto yung antibiotic na ititik niya na ulit yun. So next is patient not finishing the entire antibiotic course. Yes, ito. So na-discuss na kanina ng previous speaker, pero kailan i-discuss ko ulit na some patients or kumbaga mga ibang patients na hindi nila tinatapos yung antibiotic o yung antibiotic course na sinabi ng physician. So for example, yung pang-anim na araw is kumbaga wala ka nang nararamdaman. So parang nafi-feel mo na magaling ka na. Pero hindi totally na kumbaga hindi 100% na natanggal na yung infection na yun. Baka may natira pa doon. So dapat kumpletuhin natin para totally na mawala yung infection doon sa katawan natin. So next is overuse of antibiotics in livestock in fish farm. fish farming. So ito na yung mga abusive na mga dun sa poultry farm na once na di nga, yung example ko kanina, i-injectan niya yung ano, yung manok, parang and then the next na naman, i-injectan na naman siya. So pwede din magkaroon ng antibiotic resistant yung manok and then after nun, pwede din mapasa sa mga tao na kakain dun sa manok na yun. So next is poor infection control in healthcare settings. So ito naman yung poor infection control in healthcare settings is kumbaga sa mga rural places, kumbaga wala silang yes, may alam sila onte, pero hindi totally 100% yung kung tama ba yung gamit nilang tama ba yung paggamit ng antibiotic na yun. So yun yun, after nun is kumbaga baka mali yung paggamit nila, mali yung route of administration nila. So sometimes meron din yung kumbaga pupunta sila sa mga albularyo na which is hindi naman scientifically proven yung mga ginagawa nila. Baka mas malala pa yung mangyari dun sa patient na yun. So next is poor hygiene and sanitation. So ito is kumbaga even after okay, gumaling ka na sa sa infection na nararamdaman pero hindi ka naliligo, hindi ka nagsasabon kapag kakain na kayo. Kumbaga after mo maglaro, hindi ka na naliligo, matutulog ka na agad. So pwede bumalik yung infection na yun. So ibang paraan naman ngayon. So next is absence of new antibiotic being discovered. Yes, sinabi na natin na kanina that kailangan at kailangan ng mga pharmaceutical industries na mag-create or baga gumawa ng paraan para maka-create ng bagong antibiotic kasi sabi nga kanina that yung yung bacteria nag-evolve at nag-evolve sila at kumbaga after nag-evolve sila, naging resistant din sila sa mga antibiotic na tinitake natin. So next, Lance. So through time, bacteria have become more developed and more intelligent when it comes to recognition of antibiotics. So ito na, isipin natin that yung bacteria parang Pokemon na pa-evolve ng pa-evolve. Kapag pa-evolve na silang pa-evolve, mas lumalakas sila. So ganun din yung bacteria sa mga araw na to that na pa-evolve na sila pa-evolve, mas nagiging resistant din sila sa mga antibiotics or na-recognize nila yung antibiotics kaya useless na yung antibiotic na tinitake natin. So next is most bacteria have become resistant due to antibiotic misuse and abuse. So ito na yung common na misuse and abuse sa mga especially sa mga sa ating mga Filipino that minsan mali yung paggamit ng antibiotic which is may kilala ako ngayon na nung bata ako nagkaroon ako ng infection and then si mama ko sabi niya ito yung amoxicillin 500 milligrams yung tanggalin mo yung tablet yung powder niya ilagay mo dun sa infection mo sabi niya. So ginawa ko din yun and then yes gumaling siya pero yung concept na misuse kumbaga dapat ang tablet iniinom hindi nilalagay kumbaga yung powder hindi nilalagay dun sa mismong infection kumbaga tinitake siya so yun. So next is yung self-prescribing. So dito kumbaga parang mas magaling na tayo sa mga doktor na minsan yung especially sa mga matatanda kasi minsan hindi na sila nagpapa-check up, nagpapa-test kumbaga nagse-prescribe na sila. Kumbaga minsan yung problema din dito yung mga OTC drug kumbaga bumibili na lang sila ng OTC drug na without na test or without na kumbaga hindi tinatanong yung pharmacy or pharmacist na yon. So next is most of the time this individual takes antibiotics even when it's not needed like in case of viral infection. Yes, tama po. Sometimes may karoon lang tayo ng sore throat o yung sinus infection or lagnat. Uminom na tayo agad ng antibiotic which is hindi naman kumbaga hindi naman mapapagaling ng antibiotic yung nararamdaman natin or yung sipon or yung ubo or yung lagnat natin. So next is Lance. Ito, next factor is yung lack of knowledge in appropriate antibiotic information including its indication. Yes, tama po. Dahil sa lack of knowledge or wala tayong alam sa pag-take ng antibiotic na yun. So, mistakenly yun ng misuse. Kumbaga, nagagamit natin yung antibiotic na sa maling paraan. So, yun po. Next is over-the-counter purchases of antibiotics. Yes, yung mga OTC drugs na or OTC drugs na antibiotic na tinitake natin na minsan baka mali yung paggamit natin, and then without na walang tanong dun sa physician or yung hindi tayo nagpapatest. So next is antimicrobial resistant poultry in livestock affects the consumers when these products introduced into the body. So ito na kumbaga kanina, na-injectan mo na yung manok and then ng antibiotic, and then parang in-injectan mo ulit para hindi bumalik yung infection, and then after nun nagkaroon ng drug resistant yung manok, and then kinatay, and then pwede din yung drug resistant na yun is, or kumbaga yung bacteria na yun na drug resistant is pwede mapasa sa tao na yun. And then baka magkaroon din na mas malalang infection yung host or yung kumain ng manok na yun. So next slide. So ito na yung prevention and control of development of a drug or antibiotic resistance. So dito may 4 na mga health workers na kumbaga mabibigyan tayo ng tips or yung mga paano ma-prevent yung drug or antibiotic resistant na to. So next slide. So community or yung community health worker na to. So ito yung mga advices nila or yung mga paano ma-prevent yung antibiotic resistance. So only use antibiotics where prescribed by a doctor. Yes po. Tama po. Nasabi na to ng mga previous speaker natin, but I want to masabi ulit para para hindi niyo makalimutan na that gumamit tayo ng antibiotic pag prescribed ng doktor. Wag tayong mag-self-prescribe. Yun, dapat makinig din tayo sa mga health workers natin or yung mga doctor natin. So never use of leftover antibiotics. Yes po, tama po. Nasabi na din to ng previous speaker natin that wag tayong gumamit ng leftover antibiotics na yun. Especially may kilala din ako na na uminom ng antibiotic na suspension na galing sa kapitbahay nila kasi gumaling din yung kapitbahay niya, and then parang sabi niya parang baka gagaling din ako nito, sabi niya. So yes, gumaling siya, pero after a few months is bumalik yung infection niya. So so yun dun, yun yung mali ng patient na dapat kailangan niya uminom ng antibiotic na prescribed ng doktor kasi mas alam ng doktor na dapat ano yung dapat inumin niya. So next is prevent the infection by regularly yes, una is yung washing your hands. So sometimes tayo mga ako based on my experience na that kapag pag gutom ka na, pag bago ka kakain, 'di ba mag-wash ka pa ng kamay mo, and then dahil sa gutom ka na, bibilisan mo na lang yung pag-wash mo ng hands mo. So dapat hindi totally mawawala yung bacteria dun sa kamay mo. Dapat ang proper is 20 to 30 seconds para pag-wash ng hands mo. So yun, next is yung avoid contact with sick people. So dito, kung alam mo namang may sakit yung tao, lumayo ka na, dumistansya ka na kasi dapat maintindihan din ng may sakit na dapat dumidistansya ka lang. Pwede mo naman kamustahin yung patient o yung may sakit na kaibigan mo is gawin mo na lang, i-chat mo na lang siya, i-comfort mo na lang, or video call mo na lang siya. So yeah, next is keeping your vaccine up to date. So dito, yung keeping your vaccine up to date is kumbaga yes, alam natin mahal yung vaccine, pero ma-prevent naman to yung infection sa katawan mo kaysa naman gumamit ka ng antibiotic na baka mali pa yung paggamit mo, it can lead na naman ng antibiotic resistant yon. So be aware of changes in your health. So dapat aware ka din na kung ano yung changes sa katawan mo, or kumbaga may masakit ba sa katawan mo, and then kung may suspect ka na may infection ka, so kailangan mo pumunta doon sa physician o yung doctor. Next slide. Excuse me. So dito is ask questions. So dito sa mga patient is wag kang mahiyang tanong. So kumbaga sa kanta ni Jericho nga dun sa commercial, wag kang mahihiyang magtanong, sabi nga, 'di ba? Kung may curious ka sa gamot na 'yon, or kung may tanong ka, ask mo lang kasi para mapunan yung mga curiosity mo. So 'yun. Wag kang mahiyang magtanong sa mga health workers natin. So use antibiotics properly. So 'yun, nasabi na din kanina ng previous speakers natin. So next slide. So dito is The next is kumbaga yung magbibigay ng kumbaga advice or paano ma-prevent yung antibiotic resistant or drug resistant. Dito is next is yung physician. So follow antibiotic treatment protocol. So dito ito din is yung baga is kumbaga yung patient din dapat kung ano yung binigay o sinabi ng physician sa'yo na protocol na paano ba inumin yung antibiotic mo, sundin mo yun. Huwag kang, kumbaga, huwag matigas yung ulo, kumbaga ganun, na dapat masumunod tayo na sa mga sinasabi ng health workers natin. So, next is apply infection and prevention and control measures. Dito yung, kumbaga, mag-conduct na mga seminars para just like this sa mga nangyayari sa atin na webinar na dapat yes, gumawa ng paraan yung mga physician or yung mga health workers para mabigyan ng kaalaman about sa antibiotic resistance sa mga tao. Next is document details of the antibiotic treatment and patient chart. So dito na part is, kumbaga, wag kang paiba-iba ng doktor na pinupuntahan. Kumbaga, para ma-document or kumbaga, para alam nung doctor na yon yung history mo, kumbaga yung previous na infection mo para alam niyo yung gagawin niya at mabibigay niya antibiotic treatment sa'yo. So next is help patient understand the importance of correct use of antibiotics. Yes, yung mga physician, yes, mga pharmacist tayo dapat. And then, yung mga future magte-take ng mga physician dapat alalahanin din to that help patients understand importance. Kumbaga, ipaintindi natin may paintindi natin sa mga patients natin na paano ba yung correct ng pag-use ng antibiotic na tinitake nila. So yun, dapat gawin ng mga physician. So next is ensure the patient and caregivers understand the reasons behind the antibiotic therapy. So dito naman is, kumbaga, yung mga lola at lola natin dapat, kumbaga, for example, may sakit, nagkaroon sila infection. So dapat, meron kasama si lolo or lola na caregivers or nurse or yung kapamilya natin para kumbaga mag-guide natin yung mga lola natin pag-take ng antibiotic na to kasi yung mga matatanda mahina na yung mga mata or yung pandinig nila, so mahirapan silang pag-take ng antibiotic na to. So next is according to National Antibiotic Guidelines or NAG, health practitioner must first formulate to diagnose, which may require confirmation through laboratory tests and procedures. So dapat dito, kung suspect mo nang may nararamdaman ka ng infection sa katawan mo, dapat first pumunta tayo sa mga health workers natin or health practitioners. Wag tayo pumunta agad sa mga albularyo. Ang albularyo is, kumbaga, hindi yan scientific proven, and dapat first na pumunta tayo sa mga health practitioners or yung mga health workers natin. So and then magpa-test tayo para alam ng doktor na ano yung ibibigay niyang drug sa'yo. Next is ensure adequate for funding for stewardship and innovation. So yun na sabi na kanina that mag-create ng fund para yung mga pharmaceutical industries para magkaroon ng innovation din ng antibiotics na tinitake natin. So next, let's. Pharmacists. So yung next is yung mga pharmacists. So never dispense antibiotic without a physician prescription. So kanina dapat mga pharmacists, wag tayo mag-dispense kung walang prescription. So next is refer the patient to a physician if bacterial infection is suspected. So kung alam mo namang nakita mo na may infection siya, kumbaga masakit yung paa niya, hindi niya mailakad. So as a pharmacist, sabihin mo na dapat, ma'am, sir, pumunta na po kayo sa doktor kasi malala na po yung infection nyo. So yun dapat sabihin natin. So next is patient should take antibiotic as prescribed by their doctor. So yes, kung prescribed ng doktor, so be it, inumin ng patient. So sabihin mo doon dapat, as a pharmacist, gawin mo na din yung ano yung sinabi doon sa prescription na yan. So advise patient to complete antibiotic treatment course unless the physician advise. So advise mo yung patient na inumin niya yung kumpleto kasi may mga ibang patient na nakakalimutan yung pag-take kasi busy. So dapat meron yung follow-up din na doon sa patient na yun. So next is always follow your health workers advice when using antibiotic. Yes, ito yung pinakamalaga, always follow your health workers kasi sila mas nakakaalam sa nararamdaman mo. So, next, Lance. So, strengthen policies program implementation for infection and prevention and control measures. So, ito na yon yung kumbaga ginagawa natin na mga program na just like this na webinar para mas bigyan yung mga patient ng information about sa drug resistance na yan. So, next is antibiotics should then be prescribed and administered correctly. Ayun nga, yung first is yung proper dosage show. So, dapat, wag natin, kumbaga, kung alam mo naman natin na yung antibiotic na yun is kumbaga sa pangbata, wag na nating i-take kasi hindi yun pangbata yun eh. Hindi yun sa pangmatanda. So dapat alam na naman natin dapat yung proper dosage ng ano. So sumunod tayo sa proper dosage na din na sinabi ng doctor. Next is yung route of administration. Ngayon sinabi ko kanina yung na-experience ko noon is yung antibiotic na amoxicillin na ginagawa namin na kung ba yung powder nilalagay namin yung infection, yung kung ba yung powder nung amoxicillin is nilalagay namin sa infection doon sa paa namin, which is maliit po yon yung dapat tama yung route of administration. Kung tablet lang siya. So kung liquid na inumin mo siya. So next is to avoid unnecessary trip to doctors, officers, patient often to go to the community farmer. First, to seek regarding the infection and over the to alleviate the symptoms. So next na lang. So, ito naman yung mga veterinarian or yung mga advice ng veterinarian sa mga poultry farm para maiwasan din yung antibiotic resistant na mga hayop din. And then yung mahawaan din ng mga kumakain ng mga for example yung mga chicken hens. Next is wash your hands, shoes, and clothing before after contact with animals. Yes po. Si papa ko is farmer and then sabi ko sa kanya, "Pa, kapag after mo pumunta sa farm, pagka-uwi mo dapat maligo ka or mag-wash ka ng hands or paa mo kasi may chance din na sa kamay mo or paa mo na nagkakaroon ka na din o kung ba meron ka ng mga bacteria doon sa kamay mo din. So dapat kailangan mo mag-wash ng hands yung gagawin. So remove manure or litter from animal using outside the area. So yung mga feces or mga tayo ng mga hayop natin, which is dapat linisan din natin yung mga kumbaga kung saan sila nakatira, dapat linisan natin yung mga tain nila or feces nila kasi yung mga feces nila nagka-contain yun ng mga bacteria na yun. So keep animal feed dry and stored away from the rooted birds, insects, and other animals. So yun is yung mga pagkain ng mga hayop natin, which is kung pangmanok lang, hindi wag yung pagkain nun is para sa mga hayop sa baboy and sa manok na yun, which is mali din po yun. And then stored away, ilayo din natin sa mga wet or kung mga mabasang lugar para hindi magkaroon ng contamination. Next is ask your veterinarian to help you administer important vaccine for your animal and vaccine your animal. So dito dapat, yung mga poultry farm dapat, first, bago sila mag-inject ng antibiotic, pumunta muna sila or vaccine, pumunta muna sila sa mga vet para mas ma-inform sila kung paano ba yung proper use and then kung ano ba yung vaccine na dapat inject sa mga hayop na to. Next is improve animal antibiotic use. So, yes. Dito na part yung improve animal antibiotic use is dapat, kumbaga, mag-create din ng fund ang mga yung ibang pharmaceutical industries ng hindi lang sa para humans din, para also sa mga sa animals din na nagkakaroon ng antibiotic resistance. So, next is just animal-based foods and certified organic. So, pumili tayo ng ng pagkain ng mga hayop natin, wag yung mga tira-tira. Kumbaga, yung certified organic na siya. So, yun. Next slide. So, yung mga high incidence antibiotic resistant bacteria that causes, yun nga, it causes infectious diseases or baka mas malalang infection pa yung mas naranasan natin kapag nagkaroon tayo ng antibiotic resistant o yung yun. So next is infection caused by resistant microorganisms often to fail to respond to understand treatment resulting to prolonged illness, increase cost of therapy, increase the length of hospital stay. Kumbaga, dahil sa misuse na antibiotic is kumbaga baka mas lumala pa yung infection na nararamdaman natin and then mas mapapahaba po yung pag-stay natin doon sa hospital, and then dahil doon is kumbaga mas kuha na naman, tawag dito, mas madami naman babayaran. So, yun lang yung share ko sa inyo, guys. So, any question?
Ako po,
Yes.
will bacteria infection go away without antibiotics?
Pakiulit. Mahina.
Will bacterial infection will go away without antibiotics?
Dito, may mga infection na nararamdaman natin, especially yung mga sinus infection. So, or especially yung ear infection din. So, sometimes, hindi naman na natin kailangan ng antibiotic, or sabi natin, some infection lang na hindi na din naman natin na kailangan ng antibiotic or ibang mga gamot. Hindi, kumbaga, hindi antibiotic yung pag-take natin dapat. Kumbaga, ibang gamot din na may some drugs na yung mapapagaling yung ear infection or yung sinus infection natin. So, yun lang. So, any question? Any question?
None na po. None.
Okay. Thank you. So that's all. Thank you.
Thank you, Mr. Mark Levy, for giving valuable insights on factors in developing drug resistance and of the prevention and control. It looks like we've covered all of our questions. And to wrap up everything, let us hear Mr. Lance Adrian Avian.
Thank you, Ed. Before we end this webinar, konting recap tayo ng mga speakers natin. Our first speaker, Ms. Sadona, spoke about drug resistance. She stressed that yung drug resistance, it is a reduction in effectiveness of a drug in curing a disease or condition. So, paano na yung drug resistant work? Yung mechanism niya. Number 1 is enzyme that destroys, modify that active drug. 2, the synthesis of an altered target site against with the drug has no effect. Third is reducing drug accumulation through decreasing the permeability of cell membrane. Fourth is altering the metabolic pathway so that the reaction inhibited by the drug can be bypassed. Fifth is developing an altered enzyme that less inhibited by the drug but can still perform the metabolic function. And lastly is target mimicry. There are two types of yung resistance. The first is primary or non-genetic origin resistant, and second is acquired origin of drug resistance. In primary, the bacteria possess innate property to resist drug, and the acquired drug resistance is bacteria is acquired resistance to antibiotics either through modification. Under acquired is may dalawang types, chromosome mediate resistance and transformable drug resistance. Under chromosomes mediate, they have two types, the stepwise and outstep mutation. Under transformable drug, the second resistance are plasmid mediated resistance and transposon mediated resistance. Lastly, the mode of transfer of resistance is horizontal gene transfer and transposition. And for our second speaker, she talked about Ma'am Berario. She talked about antibiotic resistance. First, what is antibiotic? Antibiotics are powerful. They're the most misused drug. They're literally what the second speaker said that literal translation is anti against biotic living things. Antibiotic was discovered by Alexander Fleming in 1928. So how antibiotics work? Antibiotics can be broad spectrum, wide, and narrow spectrum is the specific one. Antibiotic works in one or two ways. Number one is bactericidal, and the second is bacteriostatic. So let's talk about antibiotic resistance. Antibiotic resistance is ability of microorganism to avoid harmful effects. So what causes antibiotic resistance? Number one is overuse and misuse. How antibiotics resistance can be prevented? It can be prevented to antibiotics should be the last line of defense. Second is only take antibiotics prescribed by doctor. Third is if prescribed antibiotics, finish the course. And lastly, do not use other people or leftover antibiotics. And for our third speaker, Mr. Narito, discuss factors in development of drug resistance and prevention and control. The factors antibiotic resistance is through time bacteria have become more developed and more intelligent. Most bacteria have become resistant and due to antibiotic misuse and abuse, like said the previous speaker, prescribing. And lastly, most of the time, these individuals take antibiotics even when it's not needed, like in case of viral infection. So prevention and control in development of drug antibiotics resistance, my four fields that can prevent us from drug resistance. Number one is the community. The second is the physician. Third is the pharmacist, of course. And lastly, the vet. So that's the end of the summary. So our takeaway is to avoid drug resistance, listen to your doctor.
Thank you, Mr. Lance. I think we're good for now. Thank you, everyone. It was a pleasure being with you all today. We have come to the end of our webinar. I would like to thank everyone who made this meeting possible, and I thank our speakers for their presentations. Thank you all once again for coming.